Welcome to my presentation about COVID-19 and you and what you need to think about during this time. This is a pleasure for me to be speaking with you all. I wish I could see your faces. I did speak to you all maybe about 3 years ago, maybe more than that now. And it was just a great group to talk to over at Grace Presbyterian Church. So glad to be with you again. Sorry I can't see you, and maybe we'll be able to connect again in the future. So I'm going to get right into my presentation, and then in sharing my screen with you, I will be able to tell you a little bit about, let's see if I can get on, there we go, a little bit about me and why this presentation. Of course, I was asked to speak about this, and so I am doing that for you. I'd love to talk about positive aging and staying well and dealing with whatever we're dealt with. Aging has its ups and downs, that's for sure. And so does life in general. So what is important to think about? And that's what we're going to discuss today. And I'm going to get into the goals, but I'll tell you a little bit about who I am, because some of you don't know me, even though I've been in the practice as a geriatric care manager and as a family therapist for 36 years. And I love doing community education, a lot on dementia and progressive illnesses and just healthy aging, and helping families deal with aging family members that are having problems. Many of you might be also having to take care of an older family member besides dealing with Parkinson's and with yourself or with a family member. So again, I've been doing that for a very long time, and I still do some coaching and counseling and consultations, and I work part-time for the company that bought my company, Elder Care Services, and that's Home Care Assistance, and it is with their what do I want to say? It's my honor to be representing them as I'm presenting this to you. And I'll tell you more about Home Care Assistance at the end of the presentation. So the goals for today, or this lecture, is what's important besides staying safe, review of staying safe, planning your emergency plan in case you get the illness, and an emergency plan or a go bag for more than just this kind of a crisis that will be helpful to you as well. So, and for me, the most important aspect of my presentation is helping you look at the language in your advanced healthcare directive and seeing if you might need to amend it or add to it. Or maybe, because I'm going to share with you a new document. It's not really new, but it might be a new document to you, or a form of the Advanced Healthcare Directive from the University of California Regents. And it has great language in it. So we'll be going through that. And then also for you to understand your options if you do contract COVID-19. And as we know, those options are changing all the time, but I'm going to look at some more generalized options that people are faced with when they have this illness. So what is important besides staying safe? Staying safe is extremely important. You really want to understand the illness and the treatments. And, you know, there's so much information out there in social media, and some of it is very strange and dangerous, actually, you know, like eating 3 mushrooms and 2 tomatoes and, you know, tapping your head 3 times that will prevent you from getting the illness. There's a lot of crazy stuff out there. And so you want to have a really good source. And for me, it's Stanford. And I have a link to Stanford's. They have a daily update here on new treatments, where they're at in the research for immunization, you know, the statistics, what's happening. You know, it's just really a good, sound place to get information. That's what you want to be connected with. And you don't want to necessarily look at it daily. I think we need to balance our lives with being prepared and not being overly prepared or overly focused on one aspect of life. We need to keep a balance, and definitely staying on top of what's being presented to us in our life right now with this pandemic is important, but just as important is being able to talk to your family and people you love, or do the things that you've always loved to do if possible. You want to keep doing those things. You want to have your legal document clear and up to date in case you need care at any level or care for anything. Once someone else has taken over your care, like in an acute care hospital, and you have an advocate to speak for you, you want to make sure your advocate truly understands your values and your wishes for care. And I think this presentation will open your eyes and get you thinking about some of your wishes and wants, and your don't wants that you want to make sure your advocate understands. And besides being aware of treatment options, of course, if you're connected to a place like Stanford or UCSF or the Mayo Clinic or wherever you decide to be connected to, or the CDC, I like I like the universities other than the government. I think the government does a fine job, but I like the research that's happening in the university systems. But everyone will have a different choice, but make sure it's a solid, well thought of institution that you're getting your information for, because as I say in this little bullet point, options change frequently, and I think that's good news, but you want to make sure you're connected to a source that's really valid. This is a review. You all know this, you see it in the news, but I'm going to say it as well. We all know that those with cardiac issues or breathing issues or diabetics are at higher risk. All of us over 60 at a higher list, and we want to limit our leaving our homes or having guests in our homes, and make sure that if you do, there are people that are self-quarantining as well, and not having, they're not out at the university parties and on beaches. If you have grandkids that are doing that, they're not coming in your house. You're going to talk to them via Skype or FaceTime. They're not coming in. You want to wear a mask that covers your nose and mouth and fits tight over your nose. The masks that have a little wire inside them are best. You want to use gloves when you're shopping because you're touching lots of things and reading labels. It's really hard to keep your hands clean. You want to clean your hands with hand sanitizer as soon as you get in your car. And when you get home, you're going to wash them with soap and water. And you can do that many times during the day. You want to wipe off surfaces like doorknobs and doorbells and faucets with antibacterial wipes, especially if you're having people in and out of your house, even if you're keeping social distance. The new research says that getting the disease off a surface is probably not as likely as getting it from somebody that you're been close to that is sneezing or coughing or talking loudly, laughing, shouting, protesting. You want to keep 6 feet away, probably even more if you're out in public at all times. And the exception, of course, is those you live with. A hug and a kiss feels great, and sure miss that with grandkids right now. So it's nice if you do have a partner that you can get those hugs. Try to exercise daily and eat a healthy anti-inflammatory diet. You can look that up. Those of you that have heard me lecture before, I talk about that more in detail, but you could just, go to Google and say anti-inflammatory diet, and you'll get, Dr. Weil's pyramid or something. And it's very easy to follow, and it's fun. It's not limiting at all, but it keeps you healthy. And whatever exercise you can do, again, we can't go to gyms right now, but we can do a lot indoors. And there's a lot of videos, they're not videos now, YouTube, I guess, so considered videos that you can follow an exercise program. And, you know, walking is fine too. You want to use your mask, especially if you're a place where there's a lot of people on a path. And then really, really important thing to think about during this pandemic is mindfulness practices. We can't be over-focused on the pandemic. We must find a balance in our life to stay healthy. Actually, it affects our physical health and our mental health if we are overly focused on something that's negative or brings you a feeling of fear. So we want to get engaged in things that calm our minds, quiet our minds, and connect us with beauty or nature. So doing meditations a couple of times a day, focus on breathing exercises are great. Yoga is great because it's a little bit of exercise and a little bit of focused breathing. There are a lot of chair yoga programs that you can find, a lot connected with some of the villages, like the La Marinda village has a chair yoga class. So one of the things I do every evening when I go to bed, before I fall asleep, I think about what I'm grateful for in that day. Just in the day, what I'm grateful for. And in the mornings, I think about what I'm grateful for in my life. So it's a double gratefulness kind of exercise for me. And I'm not thinking about health at all. I am thankful and grateful for the health I do have. So that might happen in morning or the daytime that I think about that, but not in relationship to the pandemic. I'm not focusing on that at all. I'm focusing on being healthy in mind and body. So being prepared in a time of COVID-19, these are some questions that are coming from the Conversation Project. And there's the link at the bottom of this slide to the Conversation Project. Something I was involved in very early in the creation of the Conversation Project. But what is most important to you? What is the most important thing to you in your life? What are you worried about most? What helps you through this difficult time? And if you become sick with COVID-19, not COVID-10, like that slide says, would you prefer to stay home or go to the hospital? You got to think about that. If you choose to go to the hospital, will you want to receive intensive care in the hospital? And list any other questions or concerns you want to bring up with your friends or your family or your provider. And usually this is your advocate under your advanced healthcare directive. And these questions that I just read to you that come from the Conversation Project, they come on a little, you know, if you download it, I put it in front of my face here somehow. If you download it, these questions are in boxes. There's like a worksheet for you to fill out. And I think for me, one of the most important aspects of this form is what's most important to you. What do you really like? What do you really value? And what you're most worried about too, that's important too. But I think when you get in touch with what's really important to you in your life, that's going to guide all your decisions as you go forward. And what you're worried about could be silly things that when you discuss silly to you think they're silly, but they're important to you. So you have to write them down. And when you discuss them with your family member or your advocate, you could talk it through, because some of the things we're worried about, there is a solution for them, a simple solution, and we're overly worried. So again, that worry interferes with the quality of our life, and we want to get a handle on that. So, as I said it earlier, we want to talk about the emergency go bags. And in this slide, we have one that talks about if you have to go to the hospital go bag. And the prepareforyourcare.org/COVID-19, I'm going to take you through their advanced healthcare directive, which you can see right here is a little kind of a snapshot of the beginning of that document. But the go have a hospital go bag, it has things on it like papers you want to take, a list of your meds, you want to take your advanced healthcare directives. You want to make sure you have a plan for your pets or your bills that might need to be paid, because a lot of people that contract COVID-19, you're in the hospital for a chunk of time. It could be 3 weeks, it could be 2 weeks, it could be 4 days, but it could be a long time. So do you have a process to take care of bill planning? And then your glasses, hearing aids, dentures, all of those things are often lost when you go to the hospital. Your mobile devices as well. So maybe some sort of a container that you can keep them in close by you, and that you're more conscious of where you're putting things like dentures, and you're not going to want to take jewelry or anything expensive. And the go bag says bring food, water, and medication you might need for a long wait. Sometimes they don't want you to eat anything, and your medical provider will tell you that. But this little list of having a hospital go bag, I think, is really important. And it might be almost the same bag you have for evacuation. And because I'm talking to you at a time of high fire danger, especially in California, and hurricanes in other parts of our country, being ready for an evacuation is, I think, important. And to have a ready kit, the 3 days of food, your water, and lots of other things. And you'll want to get that checklist that tells you exactly what you would need to pack if you had to be evacuated. And some of the evacuation or the ready checklists that you might find tell you if you only have an hour, these are the things that you should gather up. But if you look at this kit now, I think it gives you a lot of time to kind of gather that together. Since the fires in California, I have finally put together in one of those easy to put together white file boxes you could buy at a stationery store, the 3 days of food for my husband and myself. And it's just going to be, we decided that every 6 months that we would donate that food and replenish the stuff that we have in it. So there's always a circulation of food that's not expiring in that box. And again, you want to do it on things that, are high protein, easy to eat, and you don't have to necessarily cook them. So again, the different forms used for the durable power of attorney. The first link here is the California Advanced Healthcare Directive, and it's coming from the probate code. And that's the most commonly used. We often use that, and it comes in a pamphlet from the California Medical Association, and it's kind of goldenrod, gold color folder. That was the most common use. Then there's the 5 wishes, and that document, I think you might have to pay for that, like $5. But it is a little bit more, I call it touchy-feely. It has more information about what's important to you. Like for me, I like tight sheets, on my beds. And, you can write little crazy things about, quirky things, I guess, about you in that document. And so a lot of people liked it for that. The one I'm going to talk to you about definitely has room for you to write anything that's quirky or important to you in it as well. And then there are the power of attorney for healthcare that are generated by attorney. I had such a one, and I definitely customized it. And I have now customized it some more by making my attorney attach the UC Regents Prepare for Your Care form to the one he generated. And so he doesn't have to spend a whole lot of time integrating, and you can do this on your own, because you really don't need an attorney to put together your advanced healthcare directive. You have to use the probate code format, but you don't need an attorney to do that for you. Most attorneys just do it as part of your estate planning. So anyway, the UC Regents Prepare for Your Care, and I have the link of that right here, is again my favorite document. I do a national support group with a doctor colleague of mine, a geriatrician in San Francisco, Dr. Kernison, and she loves this form, and other physicians. I heard a lecture by a doctor from one of the hospices talk about this form as well. They really like it. And I'll tell you what's different about it. It's written in about, I think it's 14-point font, so you don't even need to put on your glasses to read it. It has clip art on it, and it's in color, at least 3 or 4 colors, and it's really, really clear. I won't open it. If I was doing a presentation for you at Grace Presbyterian Church, I would be opening this link and showing you the document, but doing the Zoom, it kind of gets lost and I can't get back to the presentation. But what I want to tell you about is the kinds of information in here is not in any one of the other documents that you might have seen for the Advanced Healthcare Directive, because it on page 4, and if you're taking notes, you could write page 4 and then look this up later. Or if you've had the opportunity to look at these slides real quickly, maybe you've gone through and downloaded this information before you've listened to me. That would probably be the best. But nevertheless, on page 4, it has, here are decisions your medical decision maker can make and start or stop life support or medical treatment, such as CPR. So the person that you've given power to has the ability to make these kinds of decisions for you. Whether you're to be put on a breathing machine or a ventilator, whether you're to be put on dialysis, feeding tube, blood or water transfusions being put into your body, surgery, different medicines. Maybe you feel real strongly about some medicine that you never want to have, or maybe there's something that you were allergic to and you haven't really conveyed that to someone in your circle of care. So again, these decisions that your advocate's going to make for you are very serious, and you need to have a conversation with your advocate so they know what you want should your health be in jeopardy and they need to make that decision. And they definitely can make end-of-life decisions for you too about, when you wanted to have a religious leader or spiritual leader come to you, decide if you die at your home or your office, talk about autopsy or cremation or burial. All those things need to be talked through with your decision maker. So again, before you name somebody, make sure it's somebody that could really deal with those hard kinds of dilemmas that people face when they're in a critical care situation. So you also in this document, it has a portion where you can say why you chose this person. And for me, I have 3 children, and 2 of my daughters both had children with serious cardiac issues as infants. But my younger daughter, her son had to have surgery probably 4 times now. I saw what an advocate she was for him, and that's why I chose her. And I think my other kids wondered why I did that. And there's a place in this document that you can actually put that I've chosen her because she did such a good job with grandson number 5, grandchild number 5. And you could write down anyone you would not want to help make medical decisions. Maybe there's somebody in your circle of family members that has some mental health problems or substance abuse problems, and you just don't want that person involved at all in the discussion of your care, you can put their name on that too. And then you have the opportunity to give them some flexibility, total flexibility or no flexibility with this document. And I'm going to just read you the some flexibility checkbox that says it's okay for my decision maker to change some of my decisions if the doctors think it is best. But these wishes I never want changed. And then you could write down things that you never want changed. Something, I've had clients that never want to be put on any life support, and I've had other clients of mine that want every support system available to them. They just want to always extend their life, and that's our right. But if we don't have it in writing, somebody else is going to make that decision for us. So really, really important that you make that distinction in this document. And I have not seen that, unless it's a customized document, in any other form of the Advanced Healthcare Directive, except for the Prepare for Your Care one. And how do you prefer to make medical decisions? I mean, this is a question that a lot of people haven't been asked, but it's really wonderful for your advocate to know that you prefer to make your medical decisions on your own without any input from other people, or you want to make decisions only after you've had some input from other people. I always tell people when you're going to have surgery to get a second opinion. That would be another medical person, but you know that you always want, that would be the box I would check probably. And then the third box says I prefer to have other people make medical decisions for me. And at one point in my mom's life, as she got closer to the end of her life, she wanted to just trust me to make good decisions for her, knowing her wishes. And she would have chosen that box. And that's what she did when she filled out the PULSE form. Many of you are familiar with the physician's orders for life-sustaining treatment. And if anybody has a question about that and you haven't heard about that, you can send me an email and I'll make sure you're educated on that form as well. But today I'm only going to focus on this one. And then on page 7, right after you've talked about how you prefer to make medical decisions, there's a section about what matters most. Here it goes again. What matters most in the quality of your life? Your family, your friends, your pets, your spirituality, your religion, not being a burden on your family, caring for yourself and being independent, working or volunteering, or something else. There's a lot of things that could be really, really important to you. I've had clients that are musicians and been involved in music all their life. They want classical music playing wherever they are. Another client might like country western music playing. Somebody else might want to always be exposed. Personally, for me, it's nature and trees. I like to see out of my windows trees and nature. And if I can't get outside, make sure I have some plants around me. It's really important to me. But we're all different. And that's why this document's so wonderful. And then on page 8, it talks about your current health. You know, I'm healthy. You're probably fairly healthy today too. And you know, how do you feel about your health today? What's your main goal? What's your continuum of your life? So there was a crisis, an accident, and would your main goal be to stay alive as long as possible? Or is your main goal to focus on quality of life and being comfortable? So there's that continuum, and you put in a little X on this continuum. And I would probably put my main goal is to live as long as possible, no matter what, but it wouldn't be at the very beginning of that. It wouldn't be equally important as comfortable at, you know, being comfortable. It'd be somewhere in between. It wouldn't be equal. It would be probably a little bit closer right now. because of my current health, to living as long as possible, no matter what. But it wouldn't be all the way there. So this option in this form gives you that whole continuum, and you could put your X anywhere on that line. And then there's another question about end of life. It's your current health now and that end of life. And I think this is so important in a document that, again, I haven't seen in any other document. At end of life, I would be very close to being, if I knew I was at the end of my life, I would want quality of life and comfort. I wouldn't want a lot of medical interventions if I knew that I was really at the end of my life. And so my X on this line might not be at the very end about, just don't give me anything. I might want an antibiotic, or, if I have a cold or a sore throat or something. So my X might be not towards the end of that continuum, but somewhere on that continuum that meets my values now. And it's my values now for my current health and then at end of life. And that is really helpful to the person that has to make decisions for you as well. And it also gets us thinking about our health and our life. It is a continuum, and things do happen. We do, have potholes. It's not just COVID-19. Lots of other things can happen to us and along the journey. And then on page 9, it talks about end of life. Which of the things would be very hard on the quality of your life? And you check as many as you want. Like if I was not able to feed or bathe or care for myself, or, what would be really hard for the quality of my life? Or if I'm willing to live with all these things for a chance to live longer. If you want, you can write any way you feel about at the end of life, what would make it hard, and what would you like to make it easier? I just heard at a conference I went to about a week ago, a music therapist talking about the quality of life and how it has been validated by research, improved when music was in the lives of people who are getting near the end of their life. So, I really thought about that, and I'm going to put music in my new document that I'm adding to the old document, that, soothing music, maybe just like spa music playing, not all the time, but at least some of the time during my days, would make me feel calm and comfortable. So again, if you are dying, it says, where would you want to be? At home, in the hospital, either, or I'm not sure. There are hospices, there's standalone hospices. So it gets you talking and thinking about that. Right now, I would say I would want to be in my own home with hospice, but maybe that might change depending on what was going on with my health. And remember, these documents, you can update them and change them. And I really encourage you to do that. With all of your documents, you should be looking at them at least every 5 years and seeing if you need to add or amend or delete something. I know in redoing my estate planning documents, we did a lot of little changes, some because of tax consequences, some because of changes in family dynamics, and definitely this one because this is a rather new document for my attorney to be familiar with. So also on page 10 in this document, it talks about if you were so sick you may die, what would you prefer to try? And this is the probate code, to try all life support treatments. And you have 3 choices. And the one in the middle is do a trial of life support treatments, but I don't want to stay on them. And then the third one is I don't want any life support treatments. And again, I've been in this field for 36 years, and my clients, even with advanced healthcare challenges, have wanted everything, and that's their right. And some people that are fairly healthy never want to be put on any kind of life support. So we all have different feelings about that. and we got to get them articulated in a legal document that needs to be respected. There's room in this document for organ donation and autopsy and burial wishes. And then there's a big blank page for what else should your medical providers and medical decision maker know about you and your choices for medical care. Write them down, no matter what they are. And then you sign the form. The person you have chosen does not have to sign the form, but make sure you've chosen somebody that you trust to make these hard decisions for you, and that they're going to have a copy of this. They will need to keep a copy. You'll send a copy to your physician or your medical provider. If you're Kaiser, they'll put it in the system for you. It has to be witnessed by two people that aren't medical providers and are not heirs to your estate. Maybe your next door neighbor or friend or somebody could be the witness of your signature. That's all you need to do. And if you're in a facility, there are some other stipulations like skilled nursing. You have to have the ombudsman witness it. But no, most of us just need the two what do I want to say, benefactors of your estate to witness your signature. So what if you were the agent for a parent? These questions that are in this document are really just kinds of great conversation starters. You have to understand their values, and you have to ask these good questions. So you can have a meeting with your family. So all of your siblings, maybe you have the power, but your siblings don't know what mom or dad wants or don't want. I know I had the power for my mom, and when my mom died, she was cremated, and my brothers were really surprised because my father wasn't. But my mother's mother was cremated, and of course I had to ask my mother that question, what she wanted when she died, and she said, I want to be cremated like my mother was. But my brothers were kind of upset, and it's too bad that I didn't have a conversation with them before, so they knew that that was happening, because when there's a loss in a family, everybody's feeling pretty bad, and then it felt like it was surprising to them. So again, make sure that everybody knows what the choices are that's going to be involved. And the same is true for spouses. I write a lot. I write an article for the La Miranda Weekly, and I wrote an article about, I don't know, I guess knowing what your spouse wants. It was about spousal sharing of information. And a gentleman I know in my circle of friends who's an attorney said, hey, Linda, you know, I don't think my wife and I have ever talked about what we wanted or didn't want at the end of our life. So, you know, again, it's a good time to have that conversation as well. The greatest risk for COVID-19 is for those over 85. And if you're caring for a parent, they might be close to that age. And people are living longer. There's a lot of us out there at that age or above it. This is a challenging decision with COVID-19. We've all heard about not enough ventilators, got to get everybody on especially in the beginning of COVID-19, got to get everybody on ventilators. And, you know, a ventilator is a pretty serious breathing machine. You can't eat, you're not breathing on your own. Most of the time people are pretty sedated when they're on a ventilator. So that's a choice. Well, here is another document that hopefully you will download and have a conversation about called Help with Breathing Decision Aid. And that's the link at the bottom to it. And it has these three options for breathing: ventilator, the non-invasive airway, the BiPAP, and the comfort focused treatment. And then down the side of that document are things like it's telling you what is it, what does it do, what are the benefits, what are the short-term burdens, what are the long-term burdens. And at the bottom of the little checklist or the document, I call it almost like a handout that you would have if we were meeting in person, is which options best match your values. So a ventilator, I'm just going to read you the value question answer, is if you choose the ventilator, you want the chance to extend the length of your life. If you're willing to have some discomfort and be in the ICU, you have to be in the ICU for the ventilator. You're willing to take chances that you will need long-term ventilator care. It's challenging to get people off ventilator. So those are the your values that you would have to agree with if you chose that. And then if you chose the BiPAP, you want the chance to extend the length of your life. You're willing to have some discomfort and be in the hospital, and you don't want to be on a ventilator. I have had lots of clients that they say, no, I don't want anything. And I've had to talk them into kind of using the BiPAP, that it's not like a ventilator. It's not forcing the air into it's a non-invasive airway of forcing the air. It's not like the ventilator that's invasive put into you. And then comfort focus treatment, you don't want to be on any machines and you don't want to be in the hospital, and you want to allow a natural death. My mother was on oxygen when she was in hospice, and that helped with her breathing and made her comfortable, but it didn't extend her life. It just made her comfortable. So that's a good example of comfort focused treatment, is just oxygen. So this is a wonderful document. Please look it up, download it, and it has a worksheet on it, besides the document showing you the pros and cons of all these different options for breathing. It has questions I have for my doctor after reviewing this, help with breathing information. And then it has a place for you to check, my values align most with ventilator, non-invasive airway, or comfort focused treatment. And you could put this with your advanced healthcare directive, and it just would be some nice information for the person that had to make decisions for you if you couldn't make them for yourself, to say, my mom really didn't want that, my mom wants this. And also it's a good document to have if somebody else in the family says, why aren't you doing A, B, and C? You can say mom or dad wanted this, or Aunt Susie wanted comfort focused treatment, or Uncle Ben wanted a ventilator, and that's what we're doing. Because here it is in a document that they read this, they understood it, and that's what they chose. So here's some other resources for you. I am a professional geriatric care manager, and this is the National Association of people like myself. It is an organization that has a code of ethics and a standard of practice. The majority of us are master's prepared social workers, family therapists, nurses, psychologists, and there are other disciplines as well. And not everyone comes with a license. So if you're looking for somebody in an area that you haven't gotten a personal referral for, you might want to look for somebody that has a license in their discipline. I'm licensed as a family therapist, or licensed as a social worker, licensed as a nurse. And they've been in business for at least 5 years. They've had, because a care manager has to have experience with all elements of the aging process. It really takes somebody that's taken the certification exam and they know what they're talking about to be your Sherpa, your guide, your coach. And so that's a good resource. Elder law attorneys, if you're wondering about the cost of care and you want to plan for, my God, I'm going to need skilled nursing at some point on my journey, what should we do? You want to go to NALA and find an attorney. If you're in the East Bay of San Francisco, I could probably send you 4 or 5 names of attorneys that are good with different aspects of this legal planning. Technology, there's lots of different technology out there now to help you live safely at home. And especially if you're living alone, there's lots of sensors you can get, and they can alert either a friend or a neighbor or a care manager when you've had a problem, or if you haven't gotten up in the morning. All kinds of technology. I mean, I'm just talking about one of thousands of different pieces of technology to help people age in place. And then there's benefitscheckup.org. That's a government website that if you're not sure if you've gotten all the entitlements that you're entitled to, you put your information in there, and it will come back and tell you what you're entitled to. The most overlooked benefit is somebody who served during any wartime in any of our military. For them or their spouse, there's quite a nice benefit. Again, there is a means test, and I can't remember exactly if you have less than like $100,000 in your savings accounts, you might be entitled to maybe up to $1,700 a month through the VA benefit. So that's just one. I put my information in there some time ago when I wasn't over 65, and I said I wasn't going to be entitled to anything, and I found out I was entitled to a pass to the national parks. So you'd be surprised, I guess, at what you might be entitled to. And I think it's really important if you're caring for another family member to check to make sure you're getting all the benefits they're entitled to. And then since I'm presenting this with my home care assistance hat on, I should tell you they do home care, of course, that's the name of their company. And they do a really good job. I had the opportunity of 4 different companies that wanted to buy my little company, and I chose them because of the high quality and high standards in home care that they have. So again, if you need home care any place in the United States, because this is a national company, and they cover most of the metropolitan areas and some of the suburbs as well across the country. So if you need home care, I think they're a good company. And again, here's a little bit more information about me and how to get me. I'm going to remove me from here. My picture there. Anyway, I am, as I said earlier, a licensed therapist, and I do a lot of consultations with families and helping them put a roadmap together for this long journey, especially those that have progressive illnesses. And I was the founder of Elder Care Services, and I had that company for 30 years. And I love working with families. I love teaching and sharing what I think is important to aging well and living the best life you can. And that circles me right back to mindfulness. We're talking about COVID-19 and being prepared and end of life documents, or is not that's healthcare directive. I don't consider it just an end of life document, because on this journey we many times when we need to be hospitalized for other things, not just end of life times. So I think the document is really important. But what I really want to say is find a balance in your life. If you have to, if you're over anxious about, I think we need to stay on top of things like fires, but if you're over anxious about what's going on, don't read the news. Have a news holiday. Maybe every Thursday you don't read the news, you don't watch the news. Maybe you extend that to, Thursday and Saturdays, and twice if it's making you anxious, you want to eliminate it or reduce it. Find things that just make you smile, that bring joy to your life. Maybe it's I was in Hawaii. You can see Hawaii behind me in February. Right now, it seems like it's 10 years ago because we've been so sequestered to our, our environment. But, reviewing places you've traveled, talking to old friends, writing letters to your grandkids. My granddaughter, who I do see, decided we should be pen pals. She's, a junior in college, but she decided we should be pen pals. So we're writing. I guess she wanted to have letters from grandma and not just emails and text. Interesting. But, again, find balance in your life. Again, I want to encourage you to send me any questions you might have. I'm so sorry I couldn't clarify anything because I don't have you in front of me. But I am pretty responsive to emails if they don't go to my trash file. Sometimes it gets sent there. I have no idea why that happens, but it does. So if you send me a message and it didn't get through, you've got my phone number as well. Give me a call and I will return it. May you have a wonderful day. Thank you.